Human development is the process of how humans grow and change over time. It includes everything from before birth, through childhood, adulthood, and all the way into older age. It can include physical growth, brain and body development, and changes in how people think, feel, and interact with others. In this video, we'll focus on just the very beginning of that process, the fetal development that happens during pregnancy, from fertilization through birth. Fetal development refers to all the growth and changes that happen before birth. It begins when a sperm cell and an egg cell join together in a process called fertilization, which typically occurs in one of the fallopian tubes. Fertilization creates a new cell called a zygote that starts dividing as it travels through the fallopian tube toward the uterus. Over the next few days, the zygote continues to divide, becoming a group of cells called a blastocyst. About a week after fertilization, the blastocyst reaches the uterus where it floats until it attaches to the lining of the uterus called the endometrium. This step is called implantation and marks the beginning of a pregnancy. After implantation, the cluster of cells is called an embryo. The embryonic cells begin organizing into layers that will become different parts of the body. By the third week, the embryo is made up of 3 layers called the ectoderm, mesoderm, and endoderm. Cells in the ectoderm will eventually develop into the skin, the nervous system, and the retina of the eye. Cells in the mesoderm will become connective tissue, the cardiovascular system, smooth muscle, blood, the skeleton, the endocrine system, and the reproductive system. Cells in the endoderm will form the linings of internal organs and some glands. During weeks 4 through 8, the embryo's cells rapidly multiply and grow, and they differentiate into one of the 350 different types of cells found in the human body. The body's organ systems also begin to form. At week 5, the embryo is roughly the size of a poppy seed, and by the end of week 8, it is roughly the size of a grape. Tiny buds appear and will become the arms and legs. On the head, small areas begin forming that will become the eyes and ears. Inside, early parts of the brain are developing, and a simple structure called the cardiac tube begins moving in a rhythmic motion called cardiac activity. Arm and leg buds grow longer and eventually develop elbow and knee areas. Ridges that will become fingers and toes begin to separate. The head enlarges due to rapid brain growth. In the 6th week, color begins to form in the eyes, making them easier to see. The embryo also begins having simple reflexes. In the 7th week, the liver grows larger and the intestines start to move out of the abdominal area into the umbilical cord for a short time. During the 8th week, the digits of the hands separate into webbed fingers and notches develop to indicate the start of toe formation. Eyelids develop and close, and external ears are visible. The reproductive system also starts to form, though it's too early to see the sex of the embryo. The embryo becomes a fetus during the 9th week of pregnancy. The urinary system and kidneys begin to function. Ossification, the hardening of cartilage into bone, begins at this phase, but will not be finished until after birth. The fetus's skull bones are still forming. Neurons, the building blocks of the nervous system, form rapidly in the brain in the 10th week of pregnancy. The head is very large compared to the rest of the body. The intestines move into the belly area as the abdominal wall closes, helping the digestive system form. In the 11th and 12th weeks, the fetus's facial structure becomes more recognizable, with forming nostrils and a small upper lip. Digits on the fetus's limbs continue separating. Ossification continues to create a more developed skeletal system. The reproductive organs are forming, but it's still too early to know what the sex will be. The heart of the fetus now has 4 chambers and pumps blood to other growing organ systems. During these weeks, the fetus begins as the size of a cherry tomato and grows to the size of a lime. Over the next few weeks, the skeletal system and limbs continue to grow. By week 13, the fetal facial structure is fully formed. At this stage, the fetus's growth begins to shift. Instead of rapidly making new cells, the existing cells start to grow larger, causing the fetus to grow in size. In weeks 14 and 15 of pregnancy, the glial cells begin to develop in the nervous system. These cells help support the fast brain growth that happens during the first 2 years after birth. Fetal kidneys start to produce urine. The urine becomes the amniotic fluid around the fetus when the fetus pees. Between weeks 16 and 20, there is continued organ development and growth. At week 19, a fine layer of hair begins growing on the skin, and a creamy protective coating called vernix forms to shield the skin for the rest of pregnancy. By week 20, the fetus is about the size of a banana. Internal organs like the kidneys, liver, and pancreas are active. The respiratory system starts to produce fetal breathing movements to prepare for breathing after birth. The skin of the fetus is starting to thicken and become more protective. This stage brings more frequent sucking and swallowing movements as part of the fetus's developing reflexes. Swallowing amniotic fluid helps the gastrointestinal system practice digestion and absorb important nutrients and helps the fetal lung develop. Over the next few weeks, the fetus grows to the size of a zucchini. The limbs lengthen and further developed muscles lead to more noticeable fetal movements. The lungs continue to develop, the airways branch into smaller and smaller tubes, and air sacs start to form that will eventually allow air exchange. In week 24, the fetus has developed sensory organs and now has digestive enzymes, which help break down nutrients for the body to use. Over the next few weeks, the fetus continues to grow and become more active. Fat continues to build up in the fetus. The hands are fully formed, and the fetus can make a fist. Increased nervous system activity begins coordinating body movements and breathing practice. The lungs are now producing surfactant, a substance that helps the alveoli or air sacs stay open and work properly. The number of alveoli is also increasing as the lungs continue to develop. From 28 through 32 weeks, the fetus increases fat storage, preparing to support temperature control after birth. The brain's surface begins to wrinkle and fold, which helps it grow and prepare for complex thinking and body control after birth. The fetus will be roughly the size of a cabbage at this point. The lungs and heart are in the late stages of development. Reflexes related to sight and hearing become more active. Red blood cells are now being made in the bone marrow of the skeletal system. By week 35, the fetus grows to the size of a honeydew melon. The body becomes rounder and heavier with more fat. Movements may feel stronger and space is limited inside the uterus. The lungs are nearly ready to work on their own. The skeletal system remains soft and flexible for birth and will continue hardening after birth. The fetus also stores important nutrients like iron and calcium and has a more advanced digestive system to support life after delivery. Most fetuses are now in a head-down position in preparation for birth, and while some movement may still happen, there's much less room to shift around. At 37 weeks, the pregnancy is considered full term. Most organ systems are formed and ready to work independently. The nervous system now coordinates vital functions like breathing, temperature regulation, and reflexes. Fat continues building, especially around the arms and legs, giving the fetus a fuller look. At week 39, the fetus is about the size of a watermelon. By week 40, the body is ready for labor. After birth, the fetus is now a baby and will begin life outside the uterus with the help of caregivers. How do we know about how a fetus develops when we can't see it happen? Doctors have equipment that allows them to see inside the human body. You might be familiar with equipment like an X-ray machine that lets doctors look at bones. Like an X-ray machine, an ultrasound machine allows doctors to look inside the body too, but instead of seeing bones, doctors are able to see soft tissue. An ultrasound machine can show live images from inside the body. An ultrasound scan is a medical test that uses sound waves to create an image of the body's soft tissues. Ultrasounds can be used to look at parts of the body like the bladder, kidneys, and abdomen to check glands, make sure organs are healthy, or check for causes of pain. A prenatal ultrasound is when this test is used to check or monitor a pregnancy. Prenatal ultrasounds are safe to do at any stage of pregnancy. It is recommended that at least one ultrasound is performed during a pregnancy, but it's common to have 2 or more. If there are any concerns about the pregnancy, a doctor or midwife may ask for ultrasounds to be performed more often so they have the most up-to-date information to help them make decisions. What typically happens during a prenatal ultrasound? A technician, known as a sonographer, will put gel on the abdomen. This gel helps the sound waves create an image. The technician will place a probe that is connected to a computer into the gel and move it over the abdomen. This probe sends high-frequency sound waves that the computer measures and turns into images. What information can you learn from a prenatal ultrasound? Prenatal ultrasounds can be used to confirm the expected due date, look to see if there is more than one fetus, like in the case of twins or triplets, get information about the growth of the fetus, and to make sure the pregnancy isn't growing outside of the uterus. What you're able to see depends on the type of ultrasound and the gestational duration of the pregnancy, which is a way to say how far along the pregnancy is. Because of their special training, a sonographer is able to look at the ultrasound image and take measurements. The doctor, such as an OB-GYN or radiologist, will review the images to look for signs that the fetus is developing as expected and interpret this information for the patient. A patient without this special training won't know what they're looking at. We've been looking at an ultrasound of an embryo that is about 9 weeks along. At this stage, this embryo is still very small, just about the size of a grape. The part that will develop into the head looks big compared to the rest of the body, which is expected for early development. Looking closely, it may be possible to see the early form of what will become the spine. It can look like a thin, bumpy line going down the back of the embryo. Tiny bumps are starting to show where arms and legs will grow. On the face, the areas where the eyes, nose, and mouth will be are starting to take shape. The part of the body that will develop into either a penis or a vulva and vagina is starting to grow, but it looks similar in all embryos right now. And even though they aren't visible on an ultrasound, tissue that will become the liver, stomach, and kidneys is starting to grow. It's possible to see a flicker in the chest area. This is cardiac activity, indicating that the tissue that will become the heart is developing. Now let's look at an ultrasound from 12 weeks gestation. At 12 weeks, the fetus is still small, about the size of a lime, but more features are visible on the ultrasound image. The head, body, arms, and legs are easier to see and are more developed than earlier. The fetus might move or shift positions, and these small movements can sometimes be seen on screen. The fingers and toes are more clearly shaped. It might be easier to see if a penis or vulva are forming, but it is still difficult to confirm on ultrasound. The heart, while not fully formed or functioning, is beating, and a flickering motion can usually be seen where the heart is located. With special equipment, some of the early shapes of internal organs, like the stomach or bladder, may be seen, depending on the quality of the image. The umbilical cord, which is the connecting structure between the placenta and the fetus, provides nutrients. In most pregnancies, an ultrasound is recommended around 20 weeks. This is called an anatomy scan. During this scan, a healthcare provider looks carefully at the fetus's development, measuring body parts and checking how the organs are growing and working. They may be able to see the brain, heart, spine, stomach, kidneys, bladder, and other structures. This scan can also help identify any concerns or differences in development that might need follow-up or care. Ultrasounds are a helpful medical tool that allow trained professionals to observe the fetus's development at different stages of pregnancy. While some body parts or movements may be visible on screen, understanding what's being seen requires special training and experience. Each pregnancy is unique, and what can be seen on an ultrasound can vary depending on the equipment, the stage of development, and many other factors.